Good morning everyone. I'm Sairam Vishwanathan, COO at AssistHealth. AssistHealth is a one-stop, hassle-free healthcare solution for all your loved ones. Today we have Mrs. Pallavi Bhatt, one of our navigators, here to share one of our patient stories. Good morning, ma'am.
Good morning, Sairam.
As a navigator in AssistHealth, could you please let me know about your clinical background?
In AssistHealth, I am working as a nutritionist and a navigator. So as a navigator, I help or assist my members in coordinating with the various healthcare services they would need on a premium and a priority basis.
Okay, when you say priority basis, what does it mean for a member?
Okay, on a priority basis basically means that when a member approaches us with any healthcare requirements, we see to it that the member can reach out to the healthcare providers without any delays or without any confusion. So we give them a personalized service wherein they can take care of their healthcare requirements immediately.
Okay. Could you please let me know in one of these cases where you have went above and beyond to help your member meet his healthcare need?
Okay, I can tell you about my one member who was staying in a small town outside of Bangalore, and she's a 62-year-old and she had some vision problems. So I contacted her and we got to know her requirements. We let her meet our AssistHealth doctor, and with the consultation we found out that she had some issues of cataract in her eyes. So to take this forward, we assisted her by coordinating with the doctor to know what else can be done and where proper treatment can be received. So this required going to a good hospital and a good doctor, which she needed assistance in. So what we did is we got her here to Bangalore, and we provided assistance in getting all the tests that is required for a surgery to be conducted in a hassle-free way.
When you say that test to be conducted in before the surgery, so do they have to go to an hospital for a pre-operative checkup, or what do they do?
Certain pre-operative procedures would involve blood tests. So my senior member, she did not have to go anywhere. We ensured that the blood test personnel went to her house and conducted those blood tests, and also provided her with the test results well before the surgery.
So as you said, it's a cataract surgery. They would have when it comes to a surgery or any patient who is into a surgery, the entire family just zooms in on that one person. Everyone in the family has to be involved, hands-on kind of an operation. Yes. It becomes. So everybody gives their inputs, everybody comes in. Yes. So how was the entire thing for the family as well?
Okay, when it involves procedures such as surgery, it can become a source of stress not only for the member but also for the entire family. And as you said, there can be confusions, there can be some kind of anxiety. So as a navigator, we help the member understand the procedures involved. We help them understand what actually goes into before the surgery, as well as the follow-up care, and also who is the specialist involved and the medications that need to be taken. So there is a host of things that is a part of all this. So what we did for this member is we also provided her with a hospital companion. Sometimes what happens is that a family may not be able to go for hospital visits always or be with the member always. So in that case, we provide a dedicated hospital companion. So she is a person who is trained in taking the member to the hospital and also understanding the procedures involved before the surgery is done, and also the follow-up afterwards. So this really helped the family as well as the member go through the procedure in a smooth way.
So when you said hospital companion, let's say that the current situations in Tier 1 cities like Bangalore, where most people are from other states who come here for their work and everything, they bring their parents also with them, or else kids who have went abroad and they have their parents here. For those people, it will be helpful. And as a companion, who are these people? How can I trust my parents to go with them?
Okay. These hospital companions have been carefully vetted, and they are trained in such a way that they understand the procedures involved, as in the paperwork, whatever insurance related work is there, we also train them on that. And we always do a background check before we assign any companion to our members. So whoever is assigned, we first take their requirements from the members with regards to their language preference and age preference and so on, and only after that a proper check is made is the companion assigned to the member.
So these hospital companions, are they from a healthcare background as well?
Yes, definitely, Saira, because being from a healthcare background will really help them understand the requirements of the member and the family, and also it will help the doctor to explain the procedures and the requirements better to the member in the manner which the member understands.
So he'll be like in coordinator inside the hospital for us.
Yes, Saira.
And in the last session, one of our other navigators, Juvi, told me that we will have a specific contact point of contact to assist inside the hospital. Like when it comes to companion, what I come to understand is this person will take you up from your house, be with you till the hospital visit, help you out with the paperwork and whatever the requirement inside the hospital is, and then help you get to your home back safe and
yes.
good. It seems like some of your cousins, back then I guess it's how everything happened. Someone will be always with someone to go to an hospital and everyone.
Right.
Maybe their cousin or their own daughter or son. The same way it will happen. So when it comes to companionship, could you give me an in-depth view on, as you said, they are from healthcare background, and they coordinate all the services inside the hospital. For the transport, what do they do?
Sometimes members, they have their own transportations arranged, as in they could have a vehicle at home. So the companion can take that and take the member to the hospital. In case that is not available, we see to it that the companion books a vehicle and picks a member from his or her house and drops them to the hospital, and again after the process is over ensures that if the member is safely taken back to the house.
I guess this sounds very good when it comes to a case like cataract surgery. Once the procedure is done, the member, if I go alone as a person,
yes.
as a new part of nuclear family, I can't expect anyone to leave their job and take me
yes.
to a hospital. And once the procedure is done, I won't be able to drive back or transport myself safely
Correct.
in a safe manner to the home. When I have an assistant who can carry me around and just make sure that I reach my home properly, that sounds really great. Is there anything else for this patient that you have done for this member, current member that you told? What is the after procedure?
After procedure also involves a lot of follow-up regularly to be done with the doctor to see how the procedure has gone. Besides that, they will have a lot of medications, not one or two, but sometimes more than that. So it can be a lot confusing for, especially for senior citizens, to keep track of what they are taking. So what we do as a navigator is make a patient-friendly chart or a schedule that can be shared with them, and they can easily track what medicines they are taking, what medications need to be what is getting over and needs to be refilled, so they can keep a track of whatever is needed, and they can easily use them on their own without having to depend on any family members for the same.
That sounds actually good, because what people think is anything that related to health or any surgeries happens completely into an hospital, whereas in the real life situation it has the recovery part outside of the four walls of the hospital plays a vital role also.
Yes.
You coordinate there, and also pre-operative, and during the hospital visit also you coordinate. It's like you're not there with them, but you'll always be with them, reachable for them whenever if there is any requirement for them.
Yes.
That sounds really good. Nice. And I'd like to thank you for your conversation that we really had now, and I would like to know more about your future members, stories and everything if something comes up.
Surely, Sairam, there are many more such wonderful recovery stories from our members. I'll be happy to share them with you as and when going forward.
Yeah, thank you.